Okay, everybody, we're back. Yeah. Okay. Oh, Miss Rader was talking about Thanksgiving food. I know. All right. I love Thanksgiving. It's really one of my favorite holidays. I feel like it's a low pressure holiday. The gift giving thing really stresses me out, like with Christmas and stuff, because it's really hard to give somebody the ideal gift right on cue, you know? But Thanksgiving, there's no gift giving. Yeah, I love it. You just eat too much stuff and then you sleep. Yeah. Watch football. Yeah. Drink wine. Whatever. I love it. All right, everybody. Let's talk about the thighs now. I want to actually show you some slides of the quads that live in the anterior lateral compartment of the leg. I keep saying this because I will be, drilling you later and saying what muscles exist on the anterior and lateral compartment of the leg. And you'll say the four quads, and I'll say, what are their names? And you'll say vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. And then I know what I'll say is where do they insert? And you'll say, they insert in the tibial tuberosity via the patella and the patellar tendon and ligament. And then I'll say, okay, which one crosses over two joints? And you'll say the rectus femoris. I'll say, that's brilliant. And I'll say, where does the rectus femoris have an origin of? And you'll say the anterior inferior iliac spine. I'll be like, that's brilliant too. So the rectus femoris can do two actions. And you'll say, yes, it can. I'll say, what are those two actions? You'll say, it can extend the knee. And I'll say, hey, what's the fancy name for the knee? And you'll say the tibial femoral joint. And I'll say, that's exactly right. And then I'll say, what's the other action it can do? And you'll say, flex the hip. And I'll say, what's the fancy name for the hip? And you'll say, the acetabular femoral joint or the coxal joint. I'll say, oh my gosh, that's brilliant too. And I'll say, since it can flex the hip, what else can it do? And you'll say, it can cause an anterior tilt to the pelvis. And I'll say, you are so right. Why would I care about an anterior tilt to the pelvis? And you'll say, well, anterior tilts of the pelvis can exaggerate curves of the spine, which can cause back problems. I'll be like, oh my God. It'll be great. It's going to be a great day. Mr. Singletary.
This is the human class over here.
I wanted to prepare you for literally what I would ask. I wouldn't ask one person all that, but that sounds like my exact line of thinking. Yes. Okay. All right, everybody, you beautiful people. Let's take a look at this. Bum, bum, bum. Little slideshow. Do, 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 do. I love leg muscles. Okay. We see this gorgeous thigh. We've talked about this thigh before. We've talked about what's this white strip? Who can tell me what's this white strip coming down here like this? Mr. Richards?
Flexion of the knee. Sorry, IT band.
It was good. I like that. Smarty pants. All right. Let's take a look at this really quickly, everybody. This is super important. You have the vastus medialis here. You have the rectus femoris, and you have the vastus lateralis over here. So that's 3 of the 4 quads. Why can we not see the vastus intermedius? Why can we not see the vastus intermedius? Miss Rader, please.
Because it's deep to the rectus femoris.
Yes, Miss Rader is 100% correct, everybody. It is underneath. You will never directly touch the vastus intermedius. Don't worry, you can smush through the rectus femoris and still rub it, like it's not a problem, but you're never going to actually touch it directly. You never touch any muscle directly. You're always going through skin. But my point is there's always another muscle over it. She's 100% correct. So the vastus intermedius is underneath here. It's underneath right here. It's got the rectus femoris covering it. And this rectus femoris is going way, way up here and right kind of underneath, kind of like right in this area right here. It's inserting, well, it's had an origin in the anterior inferior iliac spine. By the way, here's the anterior superior iliac spine. And just so we know, here's the sartorius crossing diagonally over these guys. We will talk about this later, but a lot of massage therapists rub over the sartorius and think they're rubbing over a knot because they tweak over this thing and they go, oh, there must be a knot in the rectus femoris, and they're usually wrong. Mr. Singletary.
Yeah, how do you pronounce PSOAS?
Psoas.
So okay, psoas.
I know it looks like psoas.
Okay.
But the P is silent.
It's silent. Okay,
Yeah.
got it.
Yeah, we're gonna learn about the the medial and lateral pterygoids later. They're up in the mouth, much later, but they're up in the mouth. And they're spelled pterygoid, but you say pterygoids.
Okay.
Yeah.
Thank you.
Yeah. Okay. And by the way, this muscle is super important. Psoas major up in here, but we'll get to that later. Anyway, so all these beautiful muscles, it's hard to tell from this picture, okay? But they all sew directly into the patella. What attaches muscle to bone? Mr. Richards.
Tendons.
Tendons attach muscle to bone, yes. So via tendons, they attach muscle to the patella. In fact, we call this tendon the common patellar tendon, right? Because they all share it, they all use it to insert in here. Then this patella is attached down to your tibia. What attaches bone to bone? Yes, Mr. Singletary.
Oops, sorry, ligament.
Ligament. And so a lot of people call this the patellar ligament. Now, by the way, you will hear, yeah, Miss Savarino, please.
If you have a tear in one of your tendons, what's something you can do that's like helpful to help bring healing to that?
If it's a minor tear, massage probably increases blood flow to that area.
What if it's a major tear?
Wow. Is it a total tear?
It's in like the supraspinatus, and it's a major tear. Is there anything I can do from a massage therapy standpoint? I'm sorry, just talking about tendons reminded me now.
No, it's okay. I don't mind. I don't mind the tangent. It's in the supraspinatus tendon, but is it a total tear in the sense that it's off the bone?
A high-grade tear on the tendon.
High-grade tear on the tendon.
Yeah.
Yeah, I would still guess massage and gentle physical therapy, because you want, because they don't want to tear it more, but they need it to start repairing, and they need to keep using it so it grows back properly.
Okay.
Yeah. I'm making this face too because I'm not really qualified to tell you what to do with major tears. But if it was me, if it was my body, I'd do massage, assuming there's not major bruising in there right now. And I would be using my arm, like first with no weights or anything, just starting to use it. Yeah, in things that work the supraspinatus, which are abductions of the glenohumeral joint. Yeah.
Yeah. Thank you.
Yeah, that's nasty. Okay, so by the way, everybody, you will sometimes hear people call this thing down here a tendon, but it's not, because bone to bone is a ligament. The reason they might call it a tendon is they consider it an extension of the tendon. They kind of think the quads come together and they really just wrap around the sesamoid bone, your patella, and then they go down into the tibia. And that's a valid way of looking at it. These are geeky things that massage therapists argue about at cocktail parties. But I like referring to it as the patellar tendon attaching to the patella, and then the patellar ligament attaching the patella to the tibial tuberosity, just because it shows a clear understanding of what's going on there. But it doesn't matter as long as you understand. Okay. Again, remember what I said about the side of the leg? This is your vastus lateralis here. It's your vastus lateralis. It makes up essentially the entire lateral side of your leg. This you're seeing back here, that's a hamstring, and that's in back. So your IT band actually runs right down your vastus lateralis. Vastus lateralis is huge. Looks like a big fish on the side of your leg. Okay. Boom, 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 boom. I was wanting to see if they had a... Oh, they kind of do. Hold on. Why won't my thing go? Well, I can't go back. Sorry, everybody. There we go. Here we can see that the rectus femoris and the vastus intermedius that's underneath it cannot be seen, and the vastus medialis and the vastus lateralis all come together and insert in the patella, and then it inserts, that's why you see this line down here, it inserts in the tibial tuberosity down here, and it helps with an extension, Mr. Richards, of the tibia kicking out there, okay? I do want to go back and see if they show flexion of the hip here. So bear with me. My keyboard is not cooperating. Da-da-da. All right. So, everybody, this is something just to think about for later. But why do they not have the rectus femoris on here? Oh, they do. Good. I thought your book was wrong for a second. The rectus femoris is one of the many muscles that helps with a flexion of, that's the sartorius there, but anyway, it's in front here. The rectus femoris is one of the many muscles, here we go, there's your rectus femoris, that help with a flexion of the hip. This is quite a list, by the way, and we will talk about this later. It's a lot of hip flexors. All right. Boom, boom, boom. Here we go. The quadriceps femoris group. On the right-hand side, you have the deeper layer, which is the vastus intermedius. I want you to think about this for a second. Its origin where it starts is it's glued to the femur. It does not cross over the hip. It's glued to the femur and it inserts into the patella, and the patella inserts into the tibia. So that's true with all these too. The vastus lateralis starting up as high as the greater trochanter. That's the greater trochanter sticking out there. Vastus lateralis is all the way up here. It goes all the way down and inserts in the patella. The vastus medialis actually wraps around the, in a way, the medial side of the leg. We'll take a look in a second here. And it goes too into the patella. The rectus femoris goes all the way up to the AIIS, the anterior inferior iliac spine. The reason this is important is if you're really trying to work the rectus femoris, you need to rub it until you run into the hip bone here. Carefully. And you can do that without violating a client, by the way. You just keep your hand kind of lateral as you're rubbing up so that you don't go medial, right? Right. Okay. And here is a lateral view of, don't look on the left, it's very confusing really. But here's a lateral view of the vastus lateralis here. Boom, boom. So let's take a look at these one at a time. Okay, so this is a very interesting view and it's very important to understanding the quads. We are so used to looking at people clothed in skin and stuffed with muscles and fat that we don't think about how small the skeleton is. Remember, you guys can see my fingers right here, that is the size of your femur. I don't care who you are. Some of your size of your femur is even smaller than that. But the largest of us in this class, the largest of us, that's the size of our femur. Right? It's not that big around. And yet nobody in class has thighs smaller than this, I would say. Right? Right? And you might, by the way, you might have thighs this big. That's very normal. But the point is, even if your thighs are very small, they're still huge compared to your femur. Where does that size come from? And if we look at the vastus medialis and vastus lateralis, they actually are so big that they can't just fit on the front of the thing. They almost attach behind it. And you guys remember the medial and lateral lips of the linea aspera? The line of asparagus in the back of your femur? They are actually almost attached in the back. Now you can still see the whole back of the femur exposed, but they're so big that they're covering the front and grabbing onto the lateral lips of the linea aspera, these lines in back. And so they are completely covering, 2/3 of the femur, really. And so the vastus lateralis really is covering the entire side of your femur. The vastus medialis is really covering the other side of the femur here. And all this other space in the leg, we're going to find out, is taken up by adductors later that cover over the top of this. But I'm just trying to give you an idea of how to look at this. So the origins for all four quads are kind of obvious if you think about a leg. So the vastus intermedius, we said, was underneath the rectus femoris, right? So it's in front of your leg. So its origin is on the anterior shaft of, I hope your book says that too after I just said it. Yeah, it says anterior and lateral, but anterior shaft of the femur. It's hooked to the femur bone. That's its anchor. Then it reaches across the knee, boom. The vastus lateralis is hooked to the lateral lip of the linea aspera, and it goes up so high that it grabs onto the kind of the base of the greater trochanter, and a little bump back there that we learned was called the gluteal tuberosity. So it's grabbing onto all that. And the medial, hold on, let me finish this thought. The vastus medialis is hooked on the medial lip of the linea aspera, but they're all hooked onto the shaft of the femur. That's their origin, just different sides of the shaft of the femur, and then insert down in the knee, except for the rectus femoris. Yes, Ms. Carrillo, please.
So the vastus intermedius under the rectus femoris reminds me of the biceps brachii when the brachialis was under the
Yes,
bicep. Is
thank
this
you.
kind of like that? And this is where maybe a lot of volume, like how big the muscle could be, is like that? I don't know.
Yeah, I don't know about the volume part. I have to think about that for a second, but it's very good. It's a very good comparison, though. Here's why it's a very good comparison. Well, you basically just said, but let me just add to it because it's brilliant what you said. So the vastus intermedius is like the brachialis. The brachialis is underneath my bicep. It only crosses over my elbow. All it does all day long is a flexion of my elbow, right? The vastus intermedius is underneath my rectus femoris. All it does all day long is an extension of my knee. I realize it's opposite action, but still the same point. Extension of my knee, that's all it does all day long, and it's kind of hidden, right? And we don't think about it. The rectus femoris crosses over two joints. The biceps brachii crosses over two joints. The biceps brachii can cause a flexion of the elbow and a flexion of the shoulder. The rectus femoris can cause an extension of the knee and a flexion of the hip. I realize the flexions and extensions are different, but the concept is very, very similar. You're absolutely right. It's a great comparison. I love it. I love it. So that's exactly true. Yeah. So the origins for these muscles tend to be in their name if you understand the muscles. The origins of these muscles tend to be in their name if you understand the muscles. If you understand that the quads essentially, in general, start on the femur and reach across the knee into the tibia. So we know they all insert into the tibial tuberosity via the patellar and the patellar ligament. That's a very fancy way of your book saying they all insert into the patella and the patella inserts into the tibia, into the tibial tuberosity. So it's just a way of them describing how this tendon inserts into the patella. The patella is then attached to the tibial tuberosity. So the technical answer is they insert into the tibial tuberosity. They get there eventually, right? Tibial tuberosity via the patella and the patellar ligament. That's the vehicle they get there. They all insert in that. You're done with that. Their origins are the vastus lateralis is on the lateral side of the femur. Well, what's on the lateral side of the femur? The lateral lip of the linea aspera. Oh, I've also got a big bump on the lateral side of my femur. Oh yeah, the greater trochanter. Oh, I've also got a little bump that's way up high there above my glutes. Oh, the gluteal tuberosity. Then the medial, vastus medialis, attaches to the medial lip of the linea aspera, right? And the vastus intermedius is right in front, so it attaches to the anterior shaft of the leg. They say anterior and lateral because your quads are all shifted a little bit laterally. And then rectus femoris is the one we all need to remember, right? Rectus femoris we all need to remember because rectus femoris can do two actions and one can really affect the back. One can really affect, by the way, any knee problem could affect the back. So you could argue that all these could affect the back, but we're talking about they can affect the pelvic tilt. And that is the rectus femoris. And the rectus femoris grabs onto, has an origin of the anterior inferior iliac spine. Kind of cool. Mr. Richards, please.
Wouldn't the sartorius affect back problems because it does rotation and also abduction? So that would, because obviously you're moving that body.
Are you saying that the sartorius can create pelvic tilt?
Yes, yeah. So it causes back problems because it does the same action as the biceps femoris, kind of.
100% true. I don't know where you got the biceps femoris. It doesn't do the same action biceps femoris, does quite the opposite of the action of the biceps femoris, but But you meant,
Same
I
with
think
rectus.
you meant to say rectus femoris.
Yeah.
You're just backwards today, sir. Yeah. Yeah.
I might just go to Australia, you know.
Yes. But anyway, you're absolutely right, sir. The sartorius can be another culprit of pelvic tilt. There's about 10 muscles that be culprits of anterior pelvic tilt, and we're going to get through all of them. And you're right. But sartorius is what I would rub. And by the way, what's the origin of the sartorius? Do you know? You kind of saw it in pictures.
You're asking me?
Yeah. Since we were talking.
That's the iliac spine as well?
That's the anterior superior iliac spine, yeah. But the point is, you're right, they're about this far from each other, sir. So if I'm rubbing all the way up a leg till I hit a bump here, when you hit a bump, by the way, on the hip, you're actually probably hitting the anterior superior iliac spine because the inferior one's kind of tilted down, you don't really feel it. So by rubbing all the way up the thigh till I hit the bone, I'm hitting both the rectus femoris and the sartorius at once. At least the origins of them, which is a great place to loosen muscles up, is at the origin. So yeah, and that's one of the reasons we rub all the way up the hip, whereas other massage therapists for some reason like to just rub the middle of muscles like this because they suck. But we're awesome, so we don't do that. We rub all the way to the bone. Yeah, I said it. Mr. Richards.
So, you know, the chains that limit you, they're not giving their customers full access to, because you can't go all the way up there because they cut you off, don't they, at certain points?
Maybe, although I think there are ways to do these type of hip rubs through the sheet, and I would guess that a lot of chains would let you do it, which I said, and I meant it. I'm going to come into your labs and show you what I'm talking about. As once we've kind of gone over the muscles that cross over the hip, and this is the start of that. So yeah, but you're absolutely right. There is some limiting. I'm sure there's some limiting. You know, and by the way, we have some limits too. So I am always limited a little bit by like what's going to be comfortable with my client, what's going to get the job done here. Does that make sense? But you're right. If they're not letting you get it anywhere up near that area, then they would be limiting you. Yeah. But I'll show you some pretty simple stuff that lets you get in really tight without violating somebody when it comes to hip flexion stuff. Okay, this is actually a really useful picture. What is in here in gray for this anterior view, right? We get to see the origin of the rectus femoris. Remember, that's where it starts, and it's not stuck anywhere on the thigh. It goes from here to here. Rectus femoris goes from here to here. The vastus intermedius is attached to all of this and goes to here. So if I wanted to do away with Mr. Richards, because I'm picking on him today, and I need to cut up his body, it'd be fairly easy to remove his rectus femoris. I just snip it here. By the way, it's really hard because the tendons are extremely strong, but I'd saw it right here, and I'd saw it down here, and I could remove his rectus femoris. Getting his vastus intermedius off would be really hard because it's glued onto all of this fascia on the bone right here. What's the fascia called that wraps around bones? So important to remember. I can't remember. Maybe Miss Clayton knows. Miss Clayton, what's the fascia that wraps around bones? Miss Clayton?
Periosteum.
Periosteum. Osteo means bones. Periosteum is the fascia that wraps around the outside of the bones that the muscle literally, its tendons literally glue into. So that's the vastus intermedius, right? The
One thing too, I don't, your mouse pointers are not working, so.
Oh, you're not seeing my mouse doing this?
No.
Oh, well, that's not very helpful. Let me see. How about now?
Yes.
Okay. Thank you. So sorry. Thank you. Thank you. All right. I know why. I didn't want to admit. I did something stupid. Get used to it. All right. So again, rectus femoris goes from here to here. These are the two spots I would snip on Mr. Richards as I'm disassembling him. The vastus intermedius, I'd have to actually scrape off this entire bone. But it too inserts down here. They all insert in the patella, and the patella hooks down in here. That's your tibial tuberosity. We actually have to flip to the back of the leg because the vastus medialis is so big and the vastus lateralis that it hooks onto all of this, which is the lateral lip of the the medial lip of the linea aspera. And it still comes wrapping around in front and gets back over to here, which is what some of you said when you talked about the patella, by the way. It ends up being a central joining point before we hook into the tibia. And then the vastus lateralis is way out here. It hooks onto the bottom of the greater trochanter, gluteal tuberosity, all the way down, and then inserts in front into this tibial tuberosity. Cool, cool, cool. These are great pictures. Gives you an idea of how big the quads are. Rectus femoris goes all the way up the hip. The rest are just hooked onto the femur. Very palpatable, right? Very palpatable. And I think that, yep, that's all you get. Okay, let me stop sharing this. Let me come back to you guys. Okay. All right. So, Miss Hendrickson, what what are the names of the 4 quadriceps femoris muscles?
Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius.
Yeah, I love that. I love that. Sorry, I'm backing up here on purpose. Okay. Yeah. Perfect. Thank you. Thank you. Mr. Overman.
Yes.
What are the names of the quadriceps femoris group?
You got the vastus lateralis, vastus intermedius, vastus medialis, and the rectus femoris.
Yeah. Cool. Thank you. Miss Pugh, what are the names of the 4 quads?
The rectus femoris, vastus intermedius, vastus medialis, and vastus lateralis.
Thank you. Miss Everson.
Yes.
Miss Everson, what are the names of the 4 quads?
All right, rectus femoris, up and down. You got your vastus medialis. Okay, the center, vastus lateralis. On the outside, and vastus intermedius.
Think about what you just said. You said in the center vastus lateralis, but lateralis means outside.
Yeah, vastus lateralis on the outside.
Good. Vastus intermedius is in the middle, right? Good. Okay, cool. Thank you, ma'am. Mr. Manzanares. Hi. Mr. Manzanares, what's the name of the 4 quads?
The vastus medius, the intermedius, the vastus medialis, the vastus lateralis, and the rectus femoris.
Cool. Can you say that one more time just because I got a little lost the way you said it? I think you're right, but just one more time.
The last one? Or?
All 4.
The vastus intermedius, the vastus medialis, and the vastus lateralis, and the rectus femoris.
Beautiful. Thank you, sir. Thank you. Ms. Osuna.
Yes.
Ms. Osuna, what's the name of the 4 quads?
We have the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedialis.
Nice. Vastus intermedius, but that's great. Okay. Ms. Dimitrik.
Yep.
Of the 4 quads, which one inserts into the tibial tuberosity via the patellar and the patellar ligament?
The rectus femoris, the vastus medialis, vastus intermedialis, and vastus
Lateralis, yeah.
lateralis.
Beautiful.
British pronunciation.
I believe that. Thank you. That was good. That was a trick question, right? And she got it. I said which one to try to throw her off, but it didn't work. All four insert there, right? Because all four create what kind of action? What do all four do, Miss Dimitruk?
Extend the knee.
Extend the knee. They allow me to kick my knee out. Boom. Nice. Mr. Richards, did you want to say something because we were smack talking you? Was that it?
You Americans are always blaming the Brits. Always blaming the Brits.
It kind of all started with the Brits, right?
Just putting it out there.
Thank you. We're kind of just a British colony, really. Okay. Mr. Ma. Hi, Mr. Ma.
Yes, sir.
What is the name of the four quad muscles?
It's rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis.
Beautiful. Intermedius, but beautiful. Which one can create an extension of my knee? Which one can create an extension of my tibial femoral joint?
Extend the knee.
Uh-huh.
All of them.
Thank you, Mr. Ma. Again, a trick question. Excellently done. They can all extend the knee. That's what they all do all day long. Cool. Thank you. Mr. Lee.
Yes, sir.
Mr. Lee, what's the name of the four quadricep muscles?
Vastus intermedius, vastus lateralis, vastus medialis, rectus femoris.
Thank you. Thank you, sir. That's perfect. We'll take it. Miss Lee.
Hi.
Hi, Miss Lee. Miss Lee, just tell me the name of the four quads.
I don't know how to say that.
Oh, we can say it together. Would you like to say it together?
Yeah.
We're just practicing, so that's fine. Okay. Vastus
Vastus
lateralis.
lateralis.
Yeah. We're gonna do that one again. Vastus
Vastus
lateralis.
lateralis.
Yeah, it's hard. It's lateralis.
Lateralis.
Beautiful. Okay. So vastus lateralis.
Vastus lateralis.
Yes. You're doing great. I know L's are really hard, so I understand. Vastus
Vastus
medialis.
medialis.
That was perfect. Vastus
Vastus
intermedius.
intermedius.
Beautiful. Rectus
Rectus
femoris.
femoris.
That was great. All right, Miss Lee, we're going to do them all one more time and I'll leave you alone, I promise. So,
Okay.
vastus lateralis.
Vastus lateralis.
Beautiful. Vastus medialis.
Vastus medialis. Alice.
That's good. That's great. Don't listen to him. You're doing great. Vastus intermedius.
Vastus
Oh, sorry.
intermedius.
Beautiful. And rectus femoris.
Rectus femoris.
Beautiful. You guys are awesome. Awesome.
Thank you very much.
You guys are great. It's really hard. Yeah. So, for all of us here that speak English or Spanish, even better, Spanish is a Romance language, but at least English has a lot of Romance language words in it and stuff. But if you're coming from an Asian culture, it's not Romance language based at all. And all of anatomy is in Latin, which is Romance language based stuff. So completely different pronunciations, and we use consonants that they don't even use. So it's really hard. That was really, really good. Okay. Speaking of which, Miss Dang. Hi, Miss Dang.
Yes.
Miss Dang, can you tell me the name of the four quadricep muscles?
Okay. Rectus femoris and rectus lateralis, vastus medialis, vastus intermedius.
That was perfect, Miss Dang. Yes.
Thank you.
Vastus lateralis, vastus medialis. No, I just throw in your daughter's name there. Yeah. Thank you, ma'am. That's perfect. Thank you. Thank you. Miss.
Thank you, sir.
Thank you, Miss Avalos.
Yes.
Miss Avalos, which quad muscles create an extension of the knee?
All of them.
Thank you. What is the technical term for the knee?
The patella.
That's the kneecap, but the knee
Oh.
joint.
Oh.
That was a good guess though.
Tibiofemoral joint.
Yeah, tibiofemoral joint, but actually I think yours is correct too. Tibiofemoral joint. I love that. Okay. Which quads create a flexion of the hip?
All of them. To combine do. Okay, let's go with the rectus femoris.
Let's do that. You're so cute. By the way, and I've said this many times, but I always want to remind you guys, if Mr. Ibarra walked in here and started throwing out random questions phrased in his phrasing, it would take me a long time to pull up that information, right? In fact, when Miss Savarino asked out of context, which was fine, Miss Savarino, but when she asked out of context about the supraspinatus, I literally spun while she was talking, trying to remember where that muscle is. And it's a super common muscle, but I was on quads. My brain was on quads and I couldn't pull them back up. I had to be like, so, I mean, I was thinking spinalis. I mean, I was going through all sorts of stuff and it took me a second. So I really understand this, but I'm not done with you yet, Miss Avalos, because you're doing so good. What is the technical term for the hip joint?
Oh my gosh.
I know. Don't make an ass out of yourself.
Acetabular.
Yeah, really good. Acetabular, where it meets the femur.
I don't know.
That's okay, my dear. Acetabular femoral joint.
I did know that.
You did know that, I know. Yeah. So what was the name? What was the technical name for the hip joint again?
The acetabular femoral joint.
Thank you. And what was the technical name for the knee again?
The tibiofemoral joint.
Thank you. Thank you, ma'am. Thank you. Thank you. Miss Rader. I'm running out of questions to ask. This is why I was thinking.
Are you looking for a hard one?
Yes. Yes. Ms. Rader, I have deep respect for your intellect, and I would not want to insult you with a simple question. I just think it would be rude. Ms. Rader, which quad can be found in the lateral compartment of the leg?
Well, they're all found in the lateral compartment of the leg.
Well, that's actually, and the anterior, you know,
Well,
the
yeah.
front and lateral. But which quad makes up the side of the leg?
The vastus lateralis.
Thank you. Thank you. Thank you. Which quad crosses over two joints?
The rectus femoris.
Yes. Which quad inserts into the tibial tuberosity via the patellar and patellar ligament?
All four of them do.
Yes. Which quad creates an extension of the knee?
All four of them do.
Yes. What is the technical name for the knee?
The tibial femoral joint.
Yes, absolutely. What's the technical name for the hip?
The acetabular femoral joint.
Yes. What quads can create an anterior tilt of the hip?
The rectus femoris. So I actually think that all of them can, but I'm not positive. But because I think that since they all hook to the femur, which is tied into the hip, that I think that they were all tight, that they could technically all create an anterior tilt. But I could be wrong.
Well, for one thing, in some ways, it doesn't matter if you're right or wrong because you're thinking, and that's really good. So, in order to move something, I have to be able to grab it.
Mhm.
And so I have a hard time seeing how the other ones could move the hip since they never get to grab the hip. Does that make sense?
Okay.
That's,
Yeah, I just was thinking because they're joined at the hip or the acetabular femoral joint.
right. But they're not joined at the acetabular femoral joint. They're just hooking onto the femur bone.
Right.
Yeah,
So it's a femur is hooked to the hip.
it is.
Just a thought.
Yeah. I know, and I'm trying to go with it kind of thing. But pulling on that femur all day long will affect whatever else thing they hook onto, which is the tibia. So you're going to be kind of the femur, the tibular, kind of doing this thing. We've got to somehow grab over to the hip to pull on that.
Right.
Yeah. By the way, I'm not suggesting for a second that messing with the knee isn't going to mess with the hip, because it will. That's for sure. Yeah. Very good.
Right.
Thank you, ma'am. Thank you.
Welcome.
Thank you. Okay, everybody. I want to release your homework because I want you to have time to do it now so that you don't have to have homework tonight. I think that you deserve that. And let's see if we can't do that. I'll tell you what you've got here if my thing will show up. Bear with me. Okay. So for homework,